Okay, so now let's talk about the risk factors and pathology for influenza virus. So, risk factors are people who are in close contact with infected individuals or people who are in small space with large groups of people, especially during the flu seasons, and the groups are not vaccinated. Under such circumstances, all peoples are in risk. And influenza mainly transmitted in school, nursing homes, workplaces, public transportation. Especially remember children below 5 years age, adults above 65 years of age, and patients who are pregnant and patients with chronic heart or lung disease are at risk of developing severe complications. Okay, so that is the risk factor of influenza virus. Now let's talk about the how influenza virus doing complications. So first of all, once a person contract the influenza virus first enters in the upper respiratory tract. Okay, and in the upper respiratory tract it spread and multiply throughout the cells lining the upper respiratory tract. Okay, so first of all, once the influenza virus enters inside the body, it first multiply and spread throughout the cells lining the upper respiratory tract. Okay, and as now a foreign particles is inside our body, our immune systems become activated and they will start producing inflammatory response. Okay, which result in visible tracheobronchial redness and swelling. Okay, not only that, the cells also starts to discharge mucus because large amount of mucus help cell to trap, and as a result eventually the virus can expel. Okay, that means these mucus things will trap the virus and helps the immune system to expel the pathogen. Okay, so the first thing is, upon getting entry inside the host, they will enter the upper respiratory tract and they will multiply and spread throughout the cell lining the upper respiratory tract. Okay, now once a foreign particles is inside our body, our immune system launch the inflammatory response which result in visible tracheobronchial swelling and redness. Okay, that is visible tracheobronchial redness and swelling, sorry for that, and as well as mucus discharge. There will be mucus discharge because cells start to produce more mucus as usual, that will help by trapping the virus to expel them from the body. Okay, now if virus can protect itself from these things, now they can have the ability to spread to nearby areas. Okay, if it can reach to the ear, it can cause otitis media. If it can reach to the sinus, it can cause sinusitis. Okay, so now not only that, if the virus can manage to invade the lower respiratory tract, that means these portions. Okay, so under such circumstances they can develop pneumonia. Okay, with pus or fluid build up in the lungs. Okay, in addition, the disease may weaken the immune systems also. That is the reason why the person who have developed pneumonia are at high risk of developing a secondary bacterial infection, and that is we have talked about during we have discussed about the symptoms of the influenza virus, right? We have talked about there that pneumonia is often associated with bacterial superinfection, that can be by streptococcus pneumonia, streptococcus pyogenes, staphylococcus aureus, that is our methicillin resistant staphylococcus aureus, that can develop severe pneumonias, and also the streptococcus pneumonias, right? So that is the pathology of influenza virus. So if we try to recap this, first of all, the person will inhale the virus. Okay, now it will enter the upper respiratory tract of the person, and in the upper respiratory tract it multiply and spread throughout the cell lining the upper respiratory tract. Okay, now immune system becomes aware about the virus and starts launching inflammatory response. Okay, this inflammatory response is the reason of tracheobronchial redness and swelling. Okay, as well as also mucus discharge, and here cells starts to produce more mucus that can help immune system by trapping the virus, and as a result they can easily expel the virus from the body. Okay, now if virus can protect themselves from this type of operations, then the virus gets the opportunity to move through further cells. If it can reach to ears, it can cause otitis media. If it can reach to sinus, it can cause sinusitis. Okay, not only that, if virus can manage to invade the lower respiratory tract, it can develop pneumonia. Okay, and pneumonia is characterized by fluid or pus developed in lungs. Okay, and most of the cases pneumonia weakens the immune system, and that is why the persons become at a higher risk of developing secondary bacterial infection, and this secondary bacterial infection may caused by, let's say, streptococcus pyogenes, streptococcus pneumonia, staphylococcus aureus type bacteria. So that is the pathology of influenza virus. So today we have discussed about the risk factor of influenza virus. So persons who are in close contact with infected individuals, or persons who are in a small space in large groups during the flu seasons, and all the persons in the groups are not vaccinated. Under such circumstances, each of the person in the groups are at risk. Not only that, children below 5 years of age, or adults above 65 years of age, or people who have developed chronic lung or chronic heart disease, or people who are pregnant, and those type of men and women are at highly risk of developing serious complication due to influenza virus. And how influenza virus doing this? First of all, influenza virus enters the upper respiratory tract. They starts to multiply and spread throughout the cells lining the upper respiratory tract. Okay, now after that the immune system starts launching a inflammatory response. This inflammatory response is the reason of tracheobronchial redness and swelling. Okay, after that, if now the cell start to producing mucus, this mucus will trap the virus and help the immune system to expel the virus. Now after that, if the virus can protect itself, it can spread to nearby areas. If it can reach the ear, it can cause otitis media. If it can reach the sinus, it can cause sinusitis. Okay, now they can also manage to invade the lower respiratory tract, and if they can do so, they can develop pneumonia. Okay, and that pneumonia is characterized by fluid or pus build-up in a lungs. In addition, they can also weaken our immune system, and as a result the persons become at a high risk of developing secondary bacterial infection. Okay, so that is for today. So today we have discussed about the pathology of influenza virus.